Hi, I'm Selena Campbell, Director of Member Services at Progyny. Our goal today is to show you what happens at a fertility clinic, the space, the people, and that brings us to RMA of New York, the fertility clinic located in Midtown Manhattan that we're going to explore today. At RMA of New York, visits start like they do at any other doctor's office. A quick chat with reception, and then, if it's their first visit, they'll usually head right in to meet their doctor. In this case, the doctor is Dr. Alan Copperman, and this office is not much different from those you'll find across the country. It's here, in the doctor's office, where the conversation about treatment options will typically take place. Fertility treatment options vary. The most common option that doctors utilize with their patients are ovulation induction, which is typically pills to induce ovulation. Then, intrauterine insemination, where sperm is introduced into the uterus close to the fallopian tubes. In vitro fertilization, which we'll dive into when we visit the lab. And third-party reproductive services like donor eggs, donor sperm, and gestational surrogacy. But prior to determining which treatment option to move forward with, the doctor needs to gain a greater understanding of their patient's situation. And they do this by performing what's called an initial evaluation or an initial consultation. Here, doctors get to know their patients, their medical history, and their family building goals. And this is where our members get to know their doctors and the clinical staff as well. The initial evaluation usually also involves some blood work at the phlebotomy room like this one, and an ultrasound in the evaluation room like the one you see here. This ultrasound and blood work can give the doctor significant information about our members' reproductive health. And from there, a diagnosis and plan of action can be quickly determined. For those doing IVF, they come into the office multiple times throughout their treatment. So in a 2-week stimulation cycle, a member might come into the office 4 to 8 times for morning monitoring. This will include a pelvic ultrasound in the exam room and more blood work. On top of coming in for ultrasounds and blood work, throughout the process, members are taking action at home. It could be as simple as taking oral medications and supplements for treatment like timed intercourse or intrauterine insemination, which is also called IUI, or when the treatment is IVF, members are self-administering injectable medications 2 times a day for a couple of weeks. These injectable medications are the hormones that allow doctors to retrieve multiple eggs in an IVF cycle. The more eggs that are retrieved generally indicates a higher likelihood of success. But these injectable medications actually require quite a bit from the patients themselves, as these are to be fully mixed and administered at home. We've seen a doctor's office, an exam room, and a phlebotomy station. And for the most part, those areas, along with reception, are the areas that patients spend their time throughout their treatment. But there is one other room that male patients will visit, and that is the collection room. While men contribute equally to infertility when it comes to fertility treatment, they provide just one thing, a semen sample, usually early during the evaluation phase and then again later when it's time to fertilize the eggs. They do so in a room like this one you see here. This is called a collection room. This room is often located next to the Andrology lab, which you see here. Here, sperm is cleaned, tested, or prepared for fertilization. The Andrology lab also contains tanks for storing frozen sperm. There are a few other areas of the fertility clinic that our members may utilize along their journey. Many of today's best clinics have in-house psych services, and these are typically available to many patients. But all patients who utilize third-party reproductive services, again that's donor eggs and sperm, and gestational surrogacy, tend to require a psychological exam. RMA of New York also has an on-site health and nutrition expert who can assist patients who have been recommended diet and exercise along their treatment. And for those doing IVF, it's all leading to a surgical procedure called the egg retrieval, which typically takes place in the fertility clinic's operating room. One part of the fertility clinic that makes a huge impact is one that patients rarely ever get to see. That, of course, is the embryology lab. There is a lot that goes on in an embryology laboratory, so put on your scrubs and your hairnet and come join us.
Welcome to the Embryology Laboratory at RMA of New York. I'm Christine Britton-Jones, the Director of the Laboratory Services here, and I wanted to take you on a tour of our lab.
An embryology lab, like the one at RMA of New York, is responsible for the safe handling of eggs, sperm, and embryos. And our labs take every precaution to ensure that everything is properly labeled and that mistakes do not happen.
We have the space in the incubator that's going to be used is labeled with 2 unique identifiers for the patient and the partner. And on the inside, again, so the shelf and the place in the incubator is labeled with the patient, and that's again into the labeled dish. So we're going to verify that the culture dish belongs to the patient that we think it is. A second embryologist is always a double check so that there's always 2 people to be sure of the origin of the embryos.
In vitro fertilization, or IVF, requires multiple steps. And the part that takes place in the lab starts with the egg retrieval. The moment eggs are retrieved from the body, the embryologists get to work. Here, you see an embryologist cleaning some eggs in preparation for fertilization.
He's using a smaller diameter, we call them stripper tips, so that he then will very gently pipette in and out of the stripper, and that sort of agitation along with the very sort of low level of enzyme concentration will get most of those coronal cells off.
Once the eggs have been prepared, the embryologist can determine which eggs are mature enough for fertilization. Once the embryologist knows how many mature eggs they'll be working with, they share that information with the doctor, and the patient receives a phone call with the update. The IVF lab is where fertilization takes place in an IVF cycle. Fertilization can occur in 2 different ways. Conventional fertilization simply involves putting some sperm in a dish with the eggs and allowing fertilization to occur naturally. And the other method is called intracytoplasmic sperm injection, or ICSI. ICSI has been a game-changing procedure, especially for cases involving male infertility, where sperm counts or motility might be low. This is a procedure where a single individual sperm cell is injected directly into an egg to fertilize it. It's a truly remarkable thing to witness, and we're excited to share it with you today.
So now Donna is going to inject a single sperm into each egg that she has there on the dish. The sperm are placed into a viscous solution called polyvinyl pyrrolidine, or PVP is the acronym we use. And that slows them down. It serves 2 purposes. So it slows the sperms down so that we can catch them. It also makes it easier to control that fluid because it's a viscous fluid. So we're using suction to control the injection. So orientation of the oocyte on the holding pipette is very important. And data within our lab has shown that we get the best results when holding the polar body at a 7 o'clock position. So now what Donna's doing is bringing that sperm down to the very tip of the injection pipette. The idea of doing that is that we want to have no extra PVP injected into the egg. And also here at RMA of New York, we use a very gentle way of breaking the oolemma, which is the membrane of the egg, which is what Donna's doing there with the circular motion. So we don't actually break it by sucking in the ooplasm, which is the standard method. Due to this, we have very, very low damage rates with ICSI, which is something that other labs contend with up to 5%. You can see with this shot too how that micropipette is only just slightly larger than the sperm itself. So it's approximately the same diameter as a single human hair, so it really is very tiny.
That is the moment of fertilization, and that can only be witnessed in an embryology lab like this one. After an egg is fertilized, it begins to divide and grow into what is called a blastocyst, a very early stage embryo. And a modern lab waits 5 to 7 days before the blastocyst is developed before determining if they are appropriate for a transfer. Embryos are monitored throughout the week to evaluate their progress.
So you're just looking at the quality of the embryo here?
Just looking at the quality of the embryo, the cell count, looking for any abnormalities in it. This is discard material.
Okay.
We wouldn't have you film us doing a live procedure.
Right.
But we do the same type of procedure, an embryo analysis, throughout the growth of the embryo. We'll look at the embryo. Yep, so we'll keep embryos about a week, usually between 5 and 7 days in the lab.
The lab is also a place where embryos are biopsied for PGTA testing, which is pre-implantation genetic testing for aneuploidy. PGTA has revolutionized IVF over the years, and it's included in all progeny coverage. Biopsied cells are sent out to a genetic lab to count the chromosomes, and this will determine if an embryo is normal or abnormal. And a normal embryo will have a transfer success rate at or above 70%, regardless of the age of the female. This technology has enabled the nation's best physicians to confidently transfer only one embryo per transfer, which significantly reduces instances of multiples. Performing a biopsy on an embryo might sound like a risky endeavor, but for labs and embryologists with experience, this is actually quite routine.
Do you do the biopsies here?
Yes.
Nice. That's scary.
I've done 24,000 embryos, so not anymore.
Yeah, there you go.
Yeah, we're a fairly high volume lab, so I mean we biopsy something on the order of 9,000 or 10,000 embryos a year. We've just refined our technique so much, and the training here is so incredible that no, I'm not worried about any procedures we do.
PGTA is a wonderful option that has really transformed fertility treatment and success rates. Progyny members have access to all of this technology without having to select specific things to pay for out of pocket. This makes a huge difference for our members. While waiting for the results of the PGTA testing, the embryos are frozen. Frozen embryos remain the same age and can be later thawed and transferred safely. The freezing process is a process called vitrification, and it's actually quite simple. The process to freeze an embryo is the same process used to freeze eggs for fertility preservation.
The final step of vitrification is to load the blastocyst onto the cryotop. With vitrification, the faster that the embryo or oocyte freezes, the better the outcome. So what we do is we apply it to the cryotop in a very tiny volume, and then remove as much of that media as is practical, and then plunge quickly into liquid nitrogen. So where it is then going to be frozen in a glass-like bead, sitting securely on top of that cryotop. Each patient will be placed in its own cane.
Frozen eggs and embryos are kept in tanks like these ones, and security measures are in place to ensure these tanks are safe and reliable.
All of Dewar, so this is a storage Dewar, all the Dewars are monitored, so 24/7. So if there's any increase in temperature, whether it be middle of the night, then a call will be given to alert the embryologist to be able to come in and check that everything's okay.
As you can see, there is a lot that goes into fertility treatment. At Progyny, we ensure that no member is going through this process alone. They have support from the great clinics in our network, and they have one-on-one support from us at Progyny through our patient care advocates. I want to thank RMA of New York for giving us such a great look into their clinic and laboratory. And if you want more information about all things fertility, you can find it at progyny.com/education. Or on our podcast, This is Infertility, which you can find at progyny.com/podcast. And you can also watch videos from the nation's leading reproductive endocrinologists on our YouTube channel at youtube.com/progyny. Thank you.